So, picture this. It's June and the lockdowns aren't completely over yet. That being said, coronavirus has made a lot of things difficult. For example, going to the doctor and accessing health resources. But I will say, I've found some tools that have helped me figure out the best ways to access healthcare because of coronavirus. So thanks, Corona. Never thought I'd say that. I'm Kayla. My pronouns are she and her. I am in New York City, which is still feeling the brunt of the coronavirus. Dun dun dun. So I've been inside a lot. And while inside, I've made friends with spiders and whatever else can figure out how to get through my window. So this is a story about me trying to figure out what was happening. It all started when I got bit by some bug. Never saw the bug, never could find the bug, but it left a spot on my face. So I scratched the little bite, whatever, and then I forgot about it. And then 2 days after that, I had this rash on my face. And I was like, what is this? Oh my goodness, da 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 da. So the first thing I did was I go online and I'm like, okay, red bumps, raised hives, something. I don't know. I tried to figure out what to even call it. I didn't know what to call it. And so when I started looking, the first thing that comes up is WebMD and a bunch of images of a bunch of different bug bites. And a lot of them looked like they could have been mine. It also didn't help that all of them were on white people, so they also didn't look like mine. But it created a barrier in figuring out what was going on with me. I had to think about what made something a valid online health resource. WebMD can sometimes be misleading, if that's the right way to put it nicely. I have plenty of friends who have turned into online hypochondriacs because every time they think something's wrong with them, they go straight to WebMD, and WebMD tells them that they have 10 days to live. If I listened to WebMD about this bug bite, I would have bought a casket or something and been just waiting around for that day. Luckily, I didn't listen to WebMD so harshly. What makes something a valid online resource? Something that I can listen to, something that has credibility. There were some key things. The first thing is it.com. So at the end, when you type it in and it's like webmd.com. So that means that it's a commercial website and it doesn't have to adhere to certain guidelines. But take, for example, the NIH, which is a .gov, or the CDC, which is a .gov, they have to adhere to a certain amount of guidelines, and they can't just put information in front of you without it being backed, without it being researched, without it being valid. So .gov, .org, and .edu mean that you're probably accessing a valid resource. But in the case of my bug bite, that still didn't help me. And I didn't even know if it had anything to do with my bug bite. It was just this itchy rash thing, and like I was just scared that my face was gonna fall off. Sorry. This was a really scary time. I gotta take a moment. Okay, so my face didn't fall off. But then I thought about, okay, how can I get access to a doctor in the middle of Corona? All the doctors by me are closed. I couldn't figure out where I could go. So then I went to the Pure Health Exchange Let's Talk portal, and there they showed a bunch of different resources with different labels for LGBTQIA, mental health, and then there was also a section for general health resources. So I clicked there, and then I clicked my city, New York City. It gave me information on where I could find a doctor. Then came my first telehealth appointment. So I'm going to reenact it. It went something like this. Hi, I have a rash on my face and it's an emergency because I don't know what it is, and it itches, and it's bumpy, and it's red. Oh, yes. Do you have the ability to FaceTime? Yeah, I can FaceTime. Okay, I'm gonna call you right now. Is it the same number? Yeah, it's the same number. Doo-doo, 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 doo-doo. That's the FaceTime noise. Hi, this is the rash. Can you see it? Boom. So that's how it went. And through that, I was able to get a prescription for some cream, and it literally worked in a week. And if I hadn't figured out through the help of Pure Health Exchange how to get to that point, maybe WebMD would have been right. Maybe the worst thing could have been what was going on. But I'm happy that I was able to see a doctor and figure it out. So then, fast forward to now. I just came back from the doctor. The way that I found this doctor was I took in mind the things that I learned when I was trying to figure out my telehealth situation and my rash situation. I looked for information from reliable authors, someone who knew what they were talking about. I looked for websites with .orgs and medical groups that were established and credible and were real and not WebMD. I'm not gonna say my new doctor is my best friend, but I'm not gonna say they're not. So that's it for me. I hope this has been helpful. Remember the tools that I used and how they helped me, and try them for yourself. I want you to let us know in the comments, what have your experiences with WebMD been like, or other online resources that were just like Yahoo Answers, or things where a bunch of different people can sound off about something and could be completely wrong. I want to hear about the times that you found using a .gov or a .edu or a .org helpful in giving you the information that you needed in the first place. Scene. Thank you for watching. We hope you'll check out some great resources at the link below. If you enjoyed our video, please give it a like. Make sure to subscribe for more videos like this one, and ring the bell to make sure you never miss out on Pure Health Exchange's content. You should also check us out on TikTok at Pure Health Exchange for more content. I'm here because I'm a health educator with Pure Health Exchange, an organization whose mission is to empower young people with the knowledge, skills, and resources we need to make healthy decisions. To see more resources from Pure Health Exchange and to ask health educators like me health-related questions, check out our Let's Talk portal in the link below.